Welcome to CSG University's Spotlight On. I'm Missy Pudamat from CSG, and I'm here speaking with Joe Caccavo, a clinical specialist in the outpatient department at Kessler Institute for Rehabilitation. Joe just gave us a very informative presentation on vestibular dysfunction and rehabilitation. So welcome, Joe. Thank you again for presenting. You had mentioned that dizziness is among the 25 most common reasons Americans visit the doctor. Can you tell us some of the most common causes for dizziness that you're seeing these patients for?
Sure. There's a lot of reasons for dizziness, and generally we're going to be seeing patients for vestibular dysfunctions, so problems with the inner ear, the most common of which is something called benign paroxysmal positional vertigo, or BPPV. But they could have some inflammation of the inner ear, and that's why I'm also seeing them. But many times they may have non-vestibular causes of dizziness, like a cardiac issue or a drug interaction situation, where they may come in and we're actually differentially diagnosing them and then sending them out.
Okay. And you mentioned that dizziness increases as we age. Why is that?
Dizziness increases as we age because as you get a little bit older, the vestibular system doesn't function 100%. Also, there are three systems in our body that help control dizziness imbalance, which is the vestibular system, the visual system, and the somatosensory system. And as we get older, vision changes, somatosensory information isn't as well understood by the brain, and so these lead to problems for older people that then can be thought of as dizziness.
How does a healthcare provider evaluate a patient to determine the causes of his or her dizziness, vertigo, whatever the case may be?
I think the most important thing is to first listen to the patient and take a really, really good history. Because if you get a really good history and you can understand what their symptoms are and what types of things cause them to have their symptoms, it's going to lead you into a direction that's going to give you clear tests that you can do. Now, as a physical therapist, there's only a certain amount of tests which are within my scope of practice, and sometimes people have dizziness which should be evaluated by a physician, and so that's where they should go.
What are some of the treatment options?
I like to think of treatment in three phases. Visual, doing eye exercises, balance exercises, and dynamic balance exercises. So when I talk about visual exercises, generally we're talking about something called the vestibular ocular reflex. And I'm going to do that in the traditional way, which is to basically have a patient shaking their head while they're looking at an image. But I'm also going to do it in a little bit more functional ways where they're looking at images that might be moving, or tossing a ball or things like that while they're moving, so that we're doing things that are a little bit more functional to everyday life. I like to also do some balance exercises because, again, those patients generally are imbalanced. And then dynamic balance exercises because we don't live in a static world. We move, we walk, we run, and patients need to be able to run and walk without being dizzy or imbalanced.
What is the role of rehabilitation in improving outcomes, and how long do you often see these patients for during the rehab process?
Sure. So a patient with a vestibular problem, again, depending on the specific diagnosis, might be seen for 1 or 2 visits if it was benign paroxysmal positional vertigo, or they might be seen for 2 to 3 months, say, with a little bit more of a significant problem. Generally, I like to see my patients twice a week and no more, because these are things that they need to do every day. So I'm going to give them a very comprehensive, detailed home exercise program that they're going to be doing every day, multiple times a day. And then they come to see me to basically change the program, modify it so that we're really addressing their specific needs and limitations. So on a daily basis when they come in, they're telling me, I had problems with this. This was easy. And then I'm modifying their treatment and homework based on that.
Great. Okay, well, thank you for your time today. We appreciate you coming in and signing off for CSG University. Have a great day.
Thank you.